Labonte. I'm a principal at Sellers Dorsey, which is a national healthcare consulting firm. And we are happy to join with our sponsors, the United States Census Bureau, Philly Pharmacy, and Merck for putting on this wonderful town hall meeting. So thank you very much. I also want to thank the over 40 national, regional, and local LGBT and mainstream organizations that have chosen to co-sponsor this town hall, knowing the importance of this topic for the LGBT community. I want to thank Drexel's program on LGBT health for hosting us in this wonderful space. But my biggest thank you is to the people in the audience. I was joking earlier that if I weren't doing this, I probably would rather be at happy hour on this first nice day after deluge over the past 4 or 5 days. So I want to thank you very much for your attendance tonight and what I hope will be an interesting and entertaining and thought-provoking town hall meeting. Well, what a better time than this to talk about LGBT health. With the stroke of a pen, rather, I think about 24 pens, the President signed into law 2 pieces of critical legislation to reform our nation's healthcare system, the last of which was just yesterday. We all know that these laws are going to have a tremendous impact on how all Americans access healthcare, and yet, while it might seem like the end of the story with him signing the legislation, I actually think it's only the beginning. Implementation, as those people who work on public policy will attest, implementation of laws is going to be key. As a community that experiences great healthcare disparities, which I hope you saw some of them scrolling up here on the screen prior to the beginning of the program, as a community that experiences those and unequal treatment under the law, the LGBT community and those living with HIV and AIDS need a seat at the table during implementation. And this town hall is designed to continue discussions that are already taking place about how we can get that seat at the table and what we should be saying when we get there. We're going to hear from some insiders from Washington, D.C., which I'm sure they'll have some interesting stories to tell after experiencing these past, 18 months or so. And we're going to hear from people on the ground who are providing care to the LGBT community. But mostly, I think we're all interested in hearing your thoughts, your experiences in dealing with healthcare providers here in Philadelphia and around the country. So the program was designed to make sure that we had as much audience participation as possible. Narit is the executive director of Mazzoni Center here in Philadelphia, and she's going to give a couple of her perspectives on why tonight is so very important for our community.
Thank you. Thank you, Chris, and welcome everybody. And the happy hour will happen after this town hall meeting. In fact, there's going to be a reception at Stir after this, so there is happy hour, open bar. So welcome again, and it is really exciting to welcome everybody to this town hall meeting. As some of you might know, Mazzoni Center is celebrating this year 30 years of our existence. And we thought, and throughout the year, we have done many, many events. We kicked it off with wonderful float at Gay Pride in June of last year. And in the fall, we had a retrospective that not only showed the history of Mazzoni Center, but really the involvement of LGBT health in the city of Philadelphia with all other organizations and the impact that it has had on the city of Philadelphia. We will, I need to put a little plug in here, we will culminate this year with a spectacular Mazzoni at the Shore Gala celebration and with a concert and a special champagne reception afterwards with Diana Ross. And no, it is not an impersonator, it is Diana Ross.